Hello, my name is Karen and I work for the Eve Appeal, the UK's gynaecological cancer research charity. So it's Ovarian Cancer Awareness Month and I'm joined again by the lovely Dr. Ellie Cannon.
Hello.
Isn't she wonderful? She's a GP and brilliant ambassador for the Eve Appeal, and in this video we're going to be talking about testing and screening for ovarian cancer. So, simple question, is there a screening programme for ovarian cancer?
No, there is not a screening program for ovarian cancer. There is not one specific test that we can do to pick up the early stages, so there is no screening program.
We do have a cervical screening program. Has that got anything to do with looking for ovarian cancer? So when you go for your smear test or cervical screening test, as it's properly known, will your ovaries or risk of ovarian cancer be looked at during that test?
No, absolutely not. So
nothing to do with it.
No, so cervical screening has got nothing to do with ovarian cancer. The only thing that I would say about that is if you've gone for your screening, then that's a great opportunity to mention any symptoms that you're worried about, but they do not have any link at all.
No. So if you've had a cervical screening test and then have symptoms for ovarian cancer, you need to go to the doctor because it has got nothing to do with it. A clear smear doesn't mean you're all good in the ovarian department.
No, not at all. It's only looking for, as you said, the cells on the cervix that could be abnormal, that could lead to cervical cancer. So nothing at all to do with your ovaries.
If I thought I might have ovarian cancer, I've got the symptoms, and I come to you as a GP.
Yeah.
I wish you were my GP.
I wish you were my patient.
Oh, thank you. We're best friends. Is there a test? Like, what happens if I think I might have ovarian cancer?
So there isn't one definitive test that will say yes or no, but we would do a combination of things. So, for example, you come in and see me. Most importantly, during that consultation is what you tell me. So is your history. So you need to be really clear on that with your diary, with your period diary, and your pain and everything else that's happening. Very clear on that. History is super important. A GP at that point should be examining you to see if there's anything they could feel in the tummy, for example, any fluid or any pelvic mass.
And is that kind of over the tummy, or is that an internal vaginal examination?
Could be both.
Yeah.
Could be both, because sometimes we do try and feel within the pelvis with an internal examination, so have to be prepared for that. And then we would take some tests if we were worried that would more than likely be a combination of blood tests and an ultrasound scan. Blood tests, we have something called CA125, which is known as a tumour marker, and that is a chemical within the blood that is released by tumours. So we have sort of a few of those, but CA125 is the one for ovarian cancer. So a blood test should look for that, and if that is raised, then that would obviously raise alarm bells for us. And also we can arrange an ultrasound scan, so what's called a transvaginal ultrasound. So the probe is going internally, and that is how we visualise the ovaries. Now, it isn't that one of those tests is going to definitively diagnose, but that's going to be the starting process.
So like a CA125 result with kind of raised levels doesn't say this person has ovarian cancer.
No, but it says that it's likely and possible. So the sort of typical pathway at that point, or if you had a sort of worrying ultrasound scan, would be that your GP would refer you for what's called a target referral. So they are the suspected cancer referrals that we do from general practice, where you are seen by a specialist within 2 weeks.
Because there's a chance that it could be something serious.
Because there's a chance. So because of the raised CA125 or because of something that was seen in an ultrasound scan. So you would be seen very quickly, and then they would be doing very quickly more tests, so likely a CT scan, for example, and other what's called imaging to look much, much closer at the ovaries.
So you as a GP kind of have to start piecing the puzzle together.
We do, and that's very much a collaboration between you and us. Most GPs should be able to get blood tests very quickly, so we're talking within 2 or 3 days turnaround to have the results. Whether or not you can get an ultrasound quickly, unfortunately, is quite postcode dependent, but most GPs should have quite good access. But if there are concerning symptoms, then all GPs will have access to what I've said, the target referrals, what we call a 2-week wait, and you should be seen by a gynecologist with scanning within 2 weeks.
So you said there isn't a screening program for ovarian cancer. Is there any research being done to try and get a screening program in place? Like, is it something that could happen or is going to happen?
We certainly hope it's something that could happen in the future, and there is research being undertaken. So, for example, the EVA Peel are supporting the OLDO trial, which is looking at women who are BRCA positives, who are high risk, who are being screened. And there is other research as well being undertaken of how we can look at maybe blood tests in combination with scanning. But there isn't really sort of anything on the cards at the moment in terms of a national screening programme.
So you said the CA125 test is often a good starting point when trying to put the picture together if someone might have an ovarian cancer. Can you as a GP give someone a CA125 test?
Yes, GPs can order a CA125 test, so that's a normal, simple blood test that is done, so that shouldn't be restricted. If somebody has got symptoms or are high risk, then that should be something that GP can order.
And the levels in the CA125 being raised could ring alarm bells for ovarian cancer, but could it be because of something else going on that the levels are raised?
Yeah, so when we look at sort of blood tests like that, and particularly when we're talking about screening, we talk about tests being sensitive and specific. So whether or not they always pick up what you're looking for, and also whether or not they only pick up what you're looking for. And it's very rare to get a test that is perfectly specific and sensitive and only says yes every time it's looking for that exact thing. So you don't just get raised CA125 in ovarian cancer. You can get raised CA125 for other reasons. But a raised CA125 should make a doctor look for the cause. They might want to do serial tests. They might want to do a scan, an ultrasound, in order to see why the CA125 is raised.